Welcome to Blumberr Podcast, everyone, where we bring you journeys of individuals who are not just part of healthcare, but are also shaping it with resilience, purpose, and relentless dedication. Today, we have with us Dr. Anitha, a critical care specialist whose journey is not just about medicine, but about perseverance, sacrifice, and an unwavering commitment to growth. She is the first doctor in her family, and she comes from a modest background and has navigated the demands of medicine alongside marriage, motherhood, and continuous learning. Her journey is a powerful reflection of grit and commitment. Today's conversation is slightly different. While Dr. Anitha has had an incredibly inspiring journey, we will focus more on something that she does and is impacting lots of lives out there. Understanding critical care, situations that families often face but are rarely prepared for. So let's begin. Welcome, Dr. Anitha. It's a pleasure to have you here.
Thank you, Mrs. Pushpa. Thank you for your kind introduction. You made me feel inspired. Means you made me feel happy, joyful for your kind words. You made me to feel the what and all I have gone through.
Oh,
And yeah.
nice. Okay, without any more delay, let's start. So, doctor, you have been the first doctor in your family, right? You built your career through sheer determination, like nobody to guide you also, I believe, back then when you decided you wanted to be a doctor on your own. So, what pushed you into taking this decision?
So for the initial of my school days and all, I was not in a big determination to become a doctor and all.
Okay.
In my fifth or sixth class, I used to tell that I want to be a collector.
Oh, nice.
So my father is in police department.
Okay.
He is a retired additional SP. At that time, he was a sub inspector of police, sub inspector of police.
Okay.
So he was doing like he was an encouragement to all of us regarding law, commitment, and all.
Okay.
So I used to have that motivation of becoming a collector and all. But gradually, I gained interest in biology, science, health, and all.
Nice.
So to say, in my 10th standard, I gained my interest in biology through one of my teachers.
Oh, nice.
Her name is Vijaya ma'am. She is in abroad now.
Okay.
She took biology for us, and there I gained interest in biological sciences. Then later on, slowly only. It's not like from the day when I want to become doctor and all. So then gradually, when I was getting good marks, I was becoming one of the topper of the class. Then slowly I gained the trust in myself. Then gradually only.
Yeah, understood.
And in my after we in Andhra Pradesh, I studied my schooling and earlier education in Andhra Pradesh. So we say it as MCET, EAMCET. That entrance was there.
Okay.
I wrote that entrance twice to get into medical education.
Okay.
Because in open category, if I want to get a seat, we need to get a very good rank, like below 1,000 and all. So all those things were there. So we took 2 long terms and all. So how I got motivation to become a doctor is like in my that in Tamil Nadu they call it as +1 and +2. In Andhra we call it as intermediate, first year and second year. Around second year only I gained interest in I have the potential to become a doctor, like that. And sometime I found like I have that service motto also in me. I mean to say I find myself happy in doing some good to others. That much I can put it. I found myself happy in doing something good to others, either teaching or helping something, or teaching somebody, like that. And also, this science is I'm a little bit naturally poor in maths, not very poor, moderately average kind of thing in maths, and I was good in memory power and all.
Okay.
So gradually, I gained interest in medical education. Then I took 2 years long term and all.
Okay.
Gradually, I came into this one. So it's a gradual journey. It's not like one day I
You
wanted.
woke up and wanted to become, but it was a gradual process where first your school teacher, Vijay ma'am,
School teacher, Vijaya. I
she,
pay my gratitude to her.
yeah. So she inspired you. Later,
He
you
inspired to learn biology.
to
Okay,
learn.
something is there in biology.
Okay.
We gained interest through her.
Okay. Hmm. And then eventually you started gaining more interest and felt that you have the capability to become a doctor, and that's how you build that determination within you that you have to become a doctor. That's
And my both my parents, my mother and father, were encouraging me a lot to pursue this education, and they facilitated in the sense being the I don't see nowadays it's little more equal between boys and girls.
yeah.
Like it's like 20 years back. I
Yes.
was studying around 2001 to 2003. I was studying long term.
Mm.
Even during that time, my dad did not discourage me or else forced me into some other thing, or such type of thing was not there. He is personally interested in health. He's a he's a police officer. In that angle, he's interested in health per se. And another thing is like he appreciated that I'm putting effort. So I should pay my gratitude, thanks, everything to my parents.
Amazing, nice. So, you have also started working early soon after you finished your medicine, right? And then you had your own family responsibilities, and alongside, you decided you will still continue pursuing whatever dreams you had. So, how did you balance all those demanding phases in your life?
Yeah, post MBBS is was little bit tough to say. Like there are a lot of options either to become MBBS itself. We can work with that like a duty medical officer. We can work like that. We can prepare a PG. We can take a non-clinical branch, or we can take a wait for a clinical branch. Or so many things are there, and lot of confusion, lot of pathways. We can try one more attempt. There are so many things to which can happen, which can go wrong, or which can be good also.
Hmm.
So at one point, I was like really episode. I was like confused what to do and all. I post MBBS, my father was retiring at the same time,
Okay.
so I did job for like one year and so in my same college. I studied in PS Medical College, Kuppam, Chittor district.
Okay.
So I did job there for 1 year. Then eventually it's in Kuppam, so it's nearer to Bangalore. So I used to up and down for Bangalore in the weekends,
Okay.
and go for the coaching and all. So this was my thing that 1 year. Then later on, I started studying for 6 to 7 months. And then I got diploma in anesthesia in SU Medical College. So that was my that's a government college, and from in 2011 I joined diploma anesthesia.
Okay.
The post MBBS period, first of all, they'll be pushing us to some other things like marriage, settlement, and all, and we have to do PG, post graduation. So that was a tough period. My parents supported me, and also the situations were very tight. I need to take something. I need to go in one pathway. So I'm very much interested in general medicine actually.
Okay. Okay.
But in view of the circumstances, everything, I chose anesthesia. But I'm really happy now that I chose anesthesia, right? Because I'm critical care.
Yeah.
But at that point of time, I was very hesitant that I was very bit of sadness was there in me that I can't get general medicine.
Okay.
Now I am very happy. Now I am really happy that I chose anesthesia at that point of time.
Understood. Now,
Later on,
go ahead. Go ahead. Go ahead. Sorry. Go ahead.
later on, I finished in 2013. Then I got married. That is next. This
Yeah. Okay. So now that you finished your graduation or post graduation in anesthesia, how did you eventually find your way into critical care and emergency medicine that you're practicing right now?
No, emergency medicine is another branch.
Okay.
Critical care is super specialty. So, while taking anesthesia itself, I inquired with my seniors and consultants and all. Though there is an option for doing super specialty in critical care. Critical care, both anesthesia, general medicine, pulmonology, emergency medicine are eligible to do critical care as a super specialty.
Okay.
So keeping it in that mind, then only I took anesthesia.
Okay.
So then eventually I chose with the intention of the choosing super specialty only. Then gradually, you want to extend the question?
Oh, that's fine. Whatever you want to tell, you can tell.
Oh, yeah. I need to say we need to do first anesthesia MD or the diploma anesthesia.
Okay.
Then we have to finish off that MD, DNB, anything. Then as a super specialty, we have option of critical care. Other options would be like cardiac anesthesia, transplant anesthesia, neuro anesthesia. These are yeah. Trauma anesthesia is also coming up now.
Okay.
These are the few branches.
Okay.
And critical care is gaining a lot of importance post COVID in India because ICUs are coming up
Yeah.
a lot, and requirement of ICU personnel both in all levels, like medical officer or a resident and a consultant and HOD. There are a lot of levels of care which has to be given in ICU. There are a lot of opportunity in ICU. So critical care is one of a very good option for people who want to take anesthesia.
Understood. So, what made you choose a critical care? Like you said, you chose anesthesia because it was one of the available branches and there, and you also knew that through anesthesia you could go into critical care. Once you had a conversation with your seniors. Now, what was that intention of yours that you wanted to go into critical care?
To say I was interested in a little bit of emergencies and like immediate life-saving things. So whichever is a procedure or a treatment which can save the life immediately. I don't mean that non-life-saving thing is lesser or something. It's equally important, but at that particular moment, that day, that hour, that minute,
Yeah.
the person who is in front of you, the doctor who is in front of you, if he knows the critical care, he can save your life. So that alone has ignited the desire in me to pursue critical care. So around my internship, we used to get myocardial infarction cases and all. There were no postgraduates in our college, so we used to monitor myocardial infarction patients and give the injections like thrombolysis and all. So doing the extensive continuous monitoring, the crucial point is continuous monitoring, appropriate activeness, dynamism to
To be in the moment. Okay.
Yeah. 1 second.
Sure.
Sorry.
No problem.
So the person who knows critical care can save the life of a patient on that particular day.
Correct.
So that made me feel interested in critical care from my MBBS days, like in internship days and all.
Understood. I also remember in our one of our conversations, you mentioned that there is an adrenaline rush. Of course, will be saving a lot of people, but there is this rush where you need to take decision in seconds, in minutes. Like you need to go through their history or whatever information you have, and you need to decide what needs to be done, and that is something. And within that minutes or the few seconds that time you have, you need to save that patient, and that is really something that you think is important. Remember you
Yeah.
saying.
Yeah. Yes. Thanks for making me remember that discussion. So, adrenal rush is one thing many people come into emergency medicine or critical care.
Mm.
What I find is like
Mm.
we cannot do multiple tests. Like we can do a few important investigations, but both clinical examination and also
Mm.
some point of care testing
Mm.
is very crucial and very crucial in decision making. We cannot think like a flowchart of multiple algorithms,
Mm.
or suppose if the heart rate is like 170 or something, we need to know whether what I have to do immediately, whether I should shock the patient, means defibrillate or cardiovert the patient, or should I it should be the protocol of that particular tachycardia or hypotension or any particular symptom. It has to imbibe in you, one thing, and you cannot do a lot of battery of tests to do something to treat a patient.
Mm.
So that's the very trickiest part of critical care. And at the same time, it's only the stabilization what we do.
Mm. Mm.
Emergency medicine and critical care, they concentrate on stabilizing the patient first. Then, then the next step is what could be the cause. Like it can be anything. Suppose, for example, if the patient he has tachycardia, it could be ventricular origin or atrial origin. I'm not going to deep of the medical science. I'm just making to understand the audience
Yeah.
regarding the decision making part of it.
Mm.
So we need to have the algorithm correct in our mind.
Mm.
Then we need to have minimal point of care of testing and proper clinical examination at that particular moment. And we need to take decision within like minutes, like 5 to 10 minutes max,
Maximum.
and sometimes in within a minute also.
Mm.
Like in case of cardiac arrest or such type of situations.
Understood. Many people, we have all heard of what ICU is or critical care is, but what you're saying is kind of like you need to be on your toes. Like you, as a doctor, you need to be on toes, and most of the cases that come to you in the critical care are kind of life and death situation, right? So, can you please help us understand what exactly is critical care?
So we have like a few cases will be like very life-threatening conditions, like I was saying, arrhythmias or severe hypotension. Hypotension means low blood pressure or something acutely happening at that particular moment.
Correct.
And few cases will be long-standing, like more than 5-6 days or more than a week or 10 days. They are stuck up in ICU with a prolonged illness, which needs to be taken care intensively by a specialist. So we all critical care specialists are also called as intensivists. So the head to toe examination we need to do, and we need to find all the possible causes for a particular symptom. That is one category. And another category is a patient is having right now some acute problem. Acute means like sudden problem. Like he has got low oxygen. The patient has got, he or she has got low blood pressure or irregular heart rate, or he is suddenly not conscious, or his consciousness has decreased. These are the few common symptoms which we see in intensive care. So that immediately we need to address such type of things. Or some other category will be there. There will be long-standing on a ventilator or on a tracheostomy or dependent on ventilator, or patient may be bedridden, nutritionally not well, inadequately nourished patient, which he has got multiple infections. The infection control part is also very very crucial. In a they may not be acute, they may not be nothing emergency happening in them, but a lot of detailed care is required to such type of patients.
Understood.
In that long-standing patients, we need chronically long-standing patients in ICU. We need multidisciplinary discussions and also multidisciplinary care to those patients.
Okay. So,
These are two general categories of ICU. Yeah.
nice. So if a patient comes into a critical care, that means he or she will have to have, like, may or may not have
Depends.
multidimensional angles to his the ailment that he is facing, and it could be acute or it could be long term existing suffering that he has.
Yeah.
Okay. So, when should a patient ideally be taken to a critical care unit versus waiting versus observing? For example, there are many patients who will have this cardiac arrest or a heart attack, right? We don't even know what is happening, like general public. Now, how do we handle such situations where we know that there is something happening, but we don't know how serious it is?
So, regarding the purpose of why I'm talking is also to gain, to give awareness in the society about critical care.
Correct.
So, these are few conditions like the patient has got chest pain suddenly, then it could be types of myocardial infarction, that is types of cardiac, this called in simple terms, it is called as heart attack. So it could be heart attack means the blood supply to the
Brain.
heart muscle is inadequate.
Okay.
Heart muscle.
Heart.
That's called as heart attack.
Okay.
In medical terms, it is called as myocardial infarction.
Okay.
So it will be like stable angina, unstable angina, non-STEMI, STEMI and all. So a particular variety which is called as STEMI. So there is the blood clot is very acute. There is complete stoppage of blood flow to the heart muscle at that particular point of time. So that heart muscle is failing. In medical terms, it is called as dysfunction.
Okay.
Left ventricular dysfunction. So that particular time, due to inadequate blood supply to the heart, the heart muscle is failing, and the patient might not able to maintain his blood pressure on its own. So we need, so that patients might develop like symptoms like chest pain, sweating. Some people may get nausea, vomiting, or involuntary defecation also sometimes, and excessive sweating, and or a squeezing type of chest pain.
Okay.
These are few symptoms of, and radiating pain to the left upper limb. Radiating pain will be spreading from the chest to jaw, or chest to back, or chest to the left upper limb, left hand. So these are two important symptoms of heart attack. So these patients, whenever it is possible, immediately take the patient immediately to a nearby hospital, and they'll give some medicines to reduce the pain of the heart attack, and then they'll take an ECG. If the symptoms like chest pain with which could be generally squeezing type of chest pain associated with this symptoms which I told, like sweating, radiation flow, left upper limb, jaw and back, and associated with vomiting, nausea, vomiting sensation, breathlessness, all these symptoms are very crucial. Immediately it has to be addressed, and they to be taken to the hospital immediately.
Okay.
And the doctors there will do an ECG and echocardiography, echo testing, 2D echo of the heart. Then they will know whether it is a real heart attack, and few blood tests like troponins, like that will be required. So, and few other basic blood tests like hemoglobin, creatinine, and all will be required to take him to angiography, coronary angiography, like that. So coronary angiography means first step is to rule out whether he has chest pain, whether he has heart attack or not. If the heart attack is confirmed, then the patient need to be put on few medicines, like one is to relieve the chest pain and few other medications to resolve the clot which has formed in the blood vessels for the heart. Means heart has got three important blood vessels. So these three important blood vessels, right coronary artery, left main and left anterior descending, and left circumflex. So these three important blood vessels, if they are blocked, they will have heart attack in particular regions of the, means that muscle of the heart will be less functioning or sometimes not at all functioning of that particular region. Sometimes two or three regions also can be not functioning. So the depending on the severity of the blood vessel blockage, the pain will be worsening and the symptoms will be more or less depending on that. And this will give you few medicines to resolve the clot, and they'll give medicines to reduce the pain and to make, sometimes if the patient has got very low blood pressure, that is called as cardiogenic shock, where the critical care team enters here. The low blood pressure is due to inadequate functioning of the heart, that is cardiogenic shock. So we have critical care has to enter, and cardiologist and critical care both has to stabilize the patient. Then next treatment will be planned.
Understood.
So, and another thing is like cardiac arrest. You have mentioned another point is like cardiac arrest. Cardiac arrest. That means complete stoppage of the heart for few minutes, or in that particular moment, heart has stopped completely.
Okay.
So that means the patient will not be responsive. He will not be breathing on his own, and there is no pulse to the patient. There are multiple causes for that. For example, we are talking about heart attack. Heart attack is there is lack of blood supply to the heart, but still the heart is beating. Heart is beating, but the blood supply is less to the heart muscles. That is heart attack. But cardiac arrest, that is complete stoppage of the heart. Complete stoppage of the heart. So there is no circulation in the
okay.
There is no circulation in the body. So here the causes will be different. I'll be explaining in later. But so here the patient is not responding. He does not have breathing. He does not have any palpable pulse. Mainly we see the carotid. Carotid means the major blood vessel in the neck is called as carotid artery.
Okay.
If there is no pulse here, we need to immediately start him on basic life support. So you might have seen in some videos or in education, in medical education, basic medical education for the common people, there is something called as basic life support. There is called as chest compressions should be given, how it should be given and all. So that has to be initiated immediately by anybody. That has to be learned by everybody, in fact.
Okay.
The basic life support is an important, crucial thing which has to be learned by every personnel. And especially people who are in public places like in railway stations, supermarkets, everything. If suddenly some patient become unresponsive, somebody has to initiate this basic life support if the patient is in cardiac arrest.
Got it. So, like when you said cardiac arrest, like in, let's say, families, right, who are facing such kind of emergencies, what are the most common mistakes that they do, doctor?
Means during cardiac arrest, or
not just cardiac arrest, any emergency it could be. It could be cardiac arrest, it could be road accident, or it could be something that has come up, right? So any of those situations, there is an emergency situation at home, or to my dear one somewhere in my office or in my home, anywhere. What are some of the most common mistakes that we as individuals do when we see such emergencies?
So most of the people, they get panic.
Huh, huh.
I cannot say it as a mistake, but it's a common human response to be
Yeah.
panicked if you don't have an idea of what is happening.
Correct, correct.
And they forget to call for help.
Hmm. Hmm.
They'll be panicked in such a way
Hmm.
they forget to ask for help. So
Okay.
I would suggest like call for ambulance or call to a near person. This basic 108 number,
Hmm.
this basic medical helplines, everybody should be aware of, and basic nearby hospitals numbers,
Hmm.
everybody should be keeping in their phone book or something.
Hmm.
So then they first they have to initiate some help. They should contact some medical help.
Understood.
That's first step. And do some people, if the patient he has got fits activity, that's called seizure activity.
Hmm.
They may put water into the mouth of the patient.
Okay.
So that's actually dangerous.
Okay.
Few of the things I'm telling. If some people, if the patient is really complaining also,
Mm-hmm.
to some amount of lack of knowledge or ignorance, they might ignore the symptoms of the patient. Oh, you are like this only every time. You will tell like this only every time. Always you might complain. Like not everybody, not all the time. Sometimes it can happen.
It happens. Yeah, yeah.
Yeah, it can happen to anybody. Any one of us, we can tell the same thing to our relatives or parents or
Yeah.
so these things and all. We need to be hyper vigilant.
Hmm.
If someone is complaining a bit of thing,
Immediately.
we need not be judgmental.
Hmm.
That is one angle. We need not panic.
Hmm.
We need not be judgmental. We need not panic, and we need to seek medical help as soon as possible, and do the appropriate. And putting water. If the patient is unresponsive, putting water into their mouth,
Shouldn't.
such type of things should not be doing.
Okay. So,
Not be done.
yeah, coming back to cardiac arrest, right? You said the heart stops working completely. So, what are the like if the early signs which indicates that this person could be going into cardiac arrest, and what should not be ignored, doctor? Like some signs that will tell us that this person is going into cardiac arrest, something that's all.
So, generally, causes of cardiac arrest are like, in simple terms, there is low oxygen,
Hmm.
low blood sugars, low temperature,
Hmm.
high potassium in the body, in the blood,
Hmm.
or high acid levels in the body.
Hmm.
So, and these are few things, and some other like toxins, trauma, some are much more complicated terms in according to some medical terms which are there. In simple terms, there should be enough oxygen for the heart to function.
Okay.
Enough what is it? Base acid balance should be balance should be appropriate,
Okay.
and the temperature should be normal. Blood glucose should be normal, and yeah, these are few important things for the heart to function.
Okay.
So there is any abnormality in these things like oxygen levels, blood pressure, and potassium levels
Hmm.
and temperature. These are few things. If they are going abnormal, then the heart can stop. Like few of the patients can be in a community point of view, how to identify, and some patient can get heart attack.
Hmm.
We already discussed. So the muscle suddenly stops. It is less functioning, and then it might function. The function may be absent, then it can stop.
Correct.
That is one of the cause also.
Hmm.
So in a community point of view, so if the patient is uneasy or they are easily sweating, they are less responsive or less conscious. I mean to say less conscious, or his blood pressure is very low. They're feeling giddy. Since like these are the few important medical emergency signs. So consciousness, temperature, blood pressure, oxygen level, heart rate, um, Yeah, these are few important things which we can monitor. And another thing is urine output. So we will not be knowing urine output immediately, but if you know the patient since long time, where if their kidney function is appropriate or not, if their urine output, general normal public cannot monitor properly. So this oxygen level, heart rate, blood pressure, blood sugars, temperatures, conscious. These are the important things which we can see in a patient, in elderly patients or patients who are having some chronic illnesses, which we basic monitoring is required in these few components. If they have low responsiveness, like low consciousness or low blood pressure or very high blood pressure also, low blood sugars and temperature or very high temperature also. These are the few things which we should be monitoring, and we need to alert the medical emergency team if you find any abnormality in this component.
Understood.
If the patient is suddenly becoming unresponsive at home, that's like cardiac arrest, or patient is throwing some fits, or in medical it's called as seizures. So fits are becoming unresponsive, or the blood pressure is very low, like maybe 50, 60 and all. These things also has to be immediately escalated to the medical emergency team, and we have to seek for help and do appropriately.
If at all, like let's say I'm in a crowd and I really don't know a person who is in front of me, they collapse, and
Yeah.
it may be for cardiac arrest or heart attack. I don't know. What?
We don't.
Yeah, we don't know. So, as general public, what should we do to help that person?
So, this is a very important question for the community.
Okay.
So, for the awareness of cardiac arrest, awareness has to be there in all public places. So, I would suggest in abroad, in some countries, they have publicly they keep automatic electric defibrillator and AED machine and all will be there, and immediately they raise a code, the code team will be arriving. In many countries it's available.
Okay.
In our country also, in major metros and in public places, in big showrooms and malls, it's available nowadays.
Okay.
I have seen in few malls. So first, everybody should know the basic life support. So one person is collapsing in front of us. So we need to see the breathing, responsiveness,
Okay.
and if possible, if you are available, see the pulse
Okay.
in the neck.
Okay.
Okay.
Hmm.
So if the patient is responding, is conscious, he might be at least out of danger.
Yeah.
If the patient is not responding, and if he is not breathing, or if he is not having any pulse, please start chest compressions on the middle of the chest. In the middle of the chest,
Heart.
please put middle of the chest, like on the heart.
On the heart.
So, in the lower end of the thoracic cage, the lower end of the rib cage, and I mean to say lower end of the, like at the nipple level,
Yeah.
or like at the rib cage level.
Understood. Understood. Yeah.
Yeah. So there we have to we have to make a fist like this. We have to make a fist like this. So with the palm of the hand, we need to put on the sternum, that middle of the chest, and do compressions. So these are called as cardiopulmonary resuscitation. That's called CPR, cardiopulmonary resuscitation. So the heart gets compression and the circulation can happen. Some circulation will happen to the brain and other important organs. So meanwhile, we need to alert the medical emergency.
Understood. So this is, I'm sorry, I forgot the name that you gave, you told for this.
Cardiopulmonary resuscitation, CPR.
So CPR is same thing? Cardiopulmonary
Resuscitation,
resuscitation.
CPR. So this is a part of basic life support.
Okay.
This basic life support awareness has to be there in the community. especially in public places. So anything can happen to anybody.
And
So
along with the CPR, the cardiac pulmonary restructuration, right? The
rest,
rest.
yeah, resuscitation.
Okay. So along with that, they also have something like air pumping.
Oxygen.
Oxygen pumping, yeah. That, as you said, it's not available everywhere. Maybe in Bangalore or in Chennai, such big cities where in certain areas, not everywhere, they have maintained that emergency kit there. But otherwise, how will we help as general public when we see somebody facing such situations?
So it says that mouth to mouth breathing can be given, but it's little bit difficult.
Ah.
Some means it will be we might be giving our infection or germs into the patient's. That is one point. But if you really have no other device, if you have any devices like some oxygen mask and ambu bag, that's ambu bag is a device which we can press on it and it delivers oxygen. So if that ambu bag is available with some mask, oxygen mask, which can be kept to the face of the patient, that's good. If it is not available, we can put a small kerchief on the mouth of the patient and we can give breath.
Understood.
Some mild transparent kerchief we can put on the face of patient and then we can instill breath into the mouth. But it's not really. Sometimes it's not very safe enough
Okay.
because we might be giving the infection from ours to them or their infection also can come to us. Both ways it's not very safe. But if the machines are available, we can give ambu bag and oxygen mask is available. That's a good thing. And if the medical emergency team is readily available at that particular moment, they can put a
Yeah.
tube into the yes, that's called as intubation. They put into a tube into the throat of a patient, and they will give oxygen through the tube to the patient through the lungs directly. That is called as endotracheal intubation. That's a medical procedure. A common man cannot do it, and it needs expertise also, practice and learning also. What best can be done is giving chest compression, which can be done by any common human being.
Understood.
Any common man can give chest compressions. That can be done by a reasonably educated person.
Understood.
That can be done by any person.
So CPR is the most important thing that a common man can do when they see such kind of emergencies, and that is like the immediate first step to be done when there is a cardiac patient seen, right, doctor?
Yeah, CPR is the most important thing. Is part of basic life support.
Understood.
If the IAED device that defibrillator is available in that particular public place or mall or something, if the medical team is available at that particular point, they can attach the pads to defibrillate or synchronize cardioversion. Then they can give the shock. That is called as defibrillation to the patient, which has to be done by paramedics or doctor
Understood. So
at that particular point of time.
other than cardiac arrest and heart attacks, there is something another important thing that is called as a silent killer, sepsis, right? What is it, and why is it often missed? Like, I wouldn't even know what sepsis is when a person is facing that. What is sepsis?
Oh. So, sepsis has got around 50 to 60% of mortality. So, for example, if the patient has got, we are talking about heart attack. Heart attack nowadays is a very, like cardiology is a very developed branch, and the early signs also, everybody has understood what is heart attack. There is awareness regarding heart issues nowadays in the community because of the development in cardiology.
True.
I'm very happy about it. But another silent killer is infections. That is
Infections. Okay.
infections. That is severe infection. In simple terms, the infections in our body, which is causing organ dysfunction, which is making the organs to fail. The level of infection is so severe, the organs are failing in simple terms. As a definition, life-threatening organ dysfunction due to dysregulated response for the infection. This is the definition.
Wow.
To make the common people to understand, in a common terms, there is an infection in the body. There is a response to the infection in the body.
Okay.
That response is causing the organs to fail.
Like, for example, please correct me, doctor, if I'm not saying it right. A lot of children nowadays have cashew nut allergies, right? And that causes some kind of infection, like skin infection or stomach pain or something like that. And then it causes respiratory issues and then they collapse. Is sepsis one of this? No. Okay.
I will put it in a this way.
Okay.
Suppose one person who is a diabetic,
Okay.
he has his sugars are not controlled. This is a very common situation which we see in hospitals.
Yes. Yes.
So he has developed some pneumonia, that is lung infection, or some urinary infection, which is very common in elderly male and female. Both male and female are prone for urinary tract infections.
Correct.
Or in seasonals, they develop pneumonia also. So pneumonia is a lung infection. But here, after certain point of time, the infection is so severe. It could be viral or bacterial. The infection is so severe that it is causing damage to other organs. Like the lung infection is not pertaining to the lung alone. Now it is damaging the kidney, damaging the heart. It is causing low blood pressure. That is called a septic shock. It is causing kidney dysfunction. That is called as acute kidney injury due to sepsis associated AKI. So that is one condition. Or it can cause brain dysfunction. That is septic encephalopathy. It is causing coagulopathy. It is causing liver failure. That is called as multi-organ dysfunction due to sepsis. Sepsis associated multi-organ failure or multi-organ dysfunction. So the death rate in cancer may be 30 to 40%, but the death rate in sepsis is almost like more than 50 to 60%.
Oh.
So to put it in a way, the infection might be rare in the community, or it cannot be rare. It can be there, but severe sepsis might be rare, but it can be a killer. So recently, in my family itself, there was a demise. So he lost the life because there is a wound infection.
Okay.
Yes. So the person has underwent debridement, means that removal of infection, the surgery to remove infection. But in spite of the surgery, the infection is so severe, his blood pressure has stopped, his kidney has stopped, he had 2 to 3 times cardiac arrest in the hospital. They have put him on ventilator. And in spite of all those things, the infection is so severe that it is causing dysfunction, means organ damage
Okay.
to all organs like heart and kidney especially, and some on liver also.
So, when you told about your one of your relatives, right? Did the families identify any early symptoms like it could be sepsis? I mean, you're into critical care, but you're telling it is a relative. So I assume you have no hand there to advise them also till the last minute.
Means they're slightly distant relatives, so they approached me in the last moment. Like he's already in one of the nearby hospital. They have kept him on ventilator. Then they have informed me. So by the time I know the situation, means here one more point to be noted is like they approached the specialist in the last moment. So that infection initially it is being treated by one
General
hospital.
physician.
They
Oh, okay.
try to decontaminate the wound,
Hmm.
do regular dressings and give basic antibiotics and all.
Understood.
After the failure of the basic measures, they try to do corrective things. Then the infection is so severe that suddenly one day the person has means he has developed breathing difficulty and slowly unresponsiveness, and he had cardiac arrest, and they have taken to another higher hospitals, and they have kept put him on ventilator, and to the kidney also failed, and blood gases were the acid levels in the body were very acidotic. Means the acid levels are being controlled by kidney. The kidney has failed, and then in the last moment, I was being approached to give an advice. So that patient required dialysis, which is the highest form of dialysis, that is CRRT. That's a slow continuous renal replacement therapy. It's such a situation where all the regular measures have failed, and all moderate measures are also have failed. Then the highest, like he's on ventilator, he's on CRRT. The community, what I would like to say here is, some infections will not be knowing it earlier. The awareness where the community needs awareness is where we should not neglect the infections in first place. It can turn into very severe things like sepsis and septic shock.
Okay.
These two important terminologies has to be understood by the community, that there can be some infection. That infection can cause multiple organ dysfunction,
Hmm.
organ failure. In simple words, the organ can be injured. Other organs like liver, kidney, brain, lungs, and heart can be failed due to infection.
Oh,
In simple words,
okay.
so that can also kill patient. We just think the cause of mortality, I mean to say the demise of a patient can be due to heart attack or cancer or such type of things. The awareness is there in the community to such type of serious disorders, long-standing disorders, or heart failure. But simple leg infections, simple urinary tract infections can also lead to such a devastating outcome, such a painful outcome to the family, and like to the patient. He's not very old also. The patient is around like 60 to 70 years. Like the family has to cope up with the loss of the patient. That is one point, and the blood sugar control has to be there, and we need to avoid infections. Avoid infections, especially in diabetics. I want to stress here, especially in diabetics, they will not be knowing the seriously because there will be autonomic neuropathy in the legs and all. So the pain they won't feel it. So due to lack of pain response, they won't know the severity of the injury, and they'll stuck up in basic management. Then adequate. I mean to say the escalation to higher treatment has not been happened due to inadequate knowledge on the sepsis.
Yeah. Okay.
So,
Huh.
so for say as a family member also and also a doctor, I request everyone. There can be a situation in every family of us. So where we don't know, we want to. It's a dear one. It's a very dear person to us, and anything can happen to anybody, and we should not neglect the infections. And keep your blood sugars under control. Keep your blood pressure under control, and appropriate treatment at appropriate time.
Understood. That's really interesting. I mean, I'm really sorry about your relative, but yeah, this is very, very serious. Doctor, before we can go ahead, I'll just inform my team, which is waiting for a meeting at 10 o'clock. I'll just inform them that we are going to continue and we'll have the meeting tomorrow. Just give me 1 minute, doctor. Please don't mind me about it.
Sure.
Thank you.
I'm sorry if I'm taking a lot of time.
No, you're not. It's very, very important information you're giving, and I think it's this video is going to be very interesting because we are going to make a lot of shots about lot of sepsis, cardiac arrest, and an awareness about all this is important. Then we have to still talk a lot more stroke, ICU, reality, and decision makings, right? And also you being the head of the department. So, doctor, you said that sepsis is one of the most silent killers, and the mortality is kind of very high. When does a simple infection actually become this serious, dangerous? Like UTI, I know you told that it is mostly in the diabetic patients, right? Is that only condition, or the aged? Sorry.
I mean to say, simple infections can be contained, can be controlled by our immune system. So people who are chronic kidney disease, immunocompromised, or who are taking some immunosuppressants, like if they are undergoing any connective tissue disorders or any anti-cancer therapy, or some few disorders which needs immunosuppression, like suppression of the immunity due to the drugs, or else who are like frail, old-aged, malnourished, or also an uncontrolled diabetes, or also few other patients are prone for regular infections, and patients who are bedridden, like due to some cause, like due to Parkinsonism or due to a stroke, previous stroke. Those patients are due to just frailty of the age, like due to weakness, due to age. They are also bedbound, long-standing bedridden. They are also prone for infections. Both there are multiple causes, mainly the immunity and also patients who are taking immunosuppressants due to some reason.
Okay, so let's
uncontrolled diabetes, I mean to say.
Uncontrolled diabetes. So let's say, doctor, there is a patient of this kind of description that you provided, right? About who could have these kinds of dangers because of infections. What, as a family, we should do to help those people not get any infection at all?
So we don't know when the infection could come, but the general precautions can be maintaining basic hygiene. In diabetics, they should maintain foot care.
Okay.
Foot care. And also wound care. And there are 5 end organs like eyes, kidney, and blood foot. The circulation will be, end artery circulation will be there. Okay. So these are the few organs that can be damaged due to long-standing uncontrolled diabetes. These things, few things has to be taken care. Infections, if you identify any kind of pain, abnormal pain or abnormal sensation in particular area, or if you have any fever, or if you have pain, fever, some ulcers, wounds, non-healing wounds will be there in the group for people who are having long-standing diabetes, and they might not be having pain also. Adequate pain response might not be there due to diabetic neuropathy. The nerve endings of the foot might be numbed due to the neuropathy due to diabetes, due to sugars. Okay. So these patients, these are few, just simply for example I'm telling, these are few patients, and patients who are elderly, above 60 to 70 years, both in males, both in men and women. Men are prone for urinary tract infections due to a condition called prostate hypertrophy, benign prostate hypertrophy, which can be due to enlargement of the prostate gland.
Okay.
This is a natural phenomenon which can occur in the elderly people.
Okay.
So that benign enlargement of the prostate gland can cause obstruction to the urinary flow.
Okay.
That can cause urinary retention and that can initiate infections in the urinary tract. So
Mm-hmm.
that can become a storage of urine, then that is getting infected by the bacteria, and that is causing both urinary tract infection and causing kidney infection, and the kidney infection is so severe that it is causing into
Yeah.
urosepsis,
Yeah.
and it is leading to multi-organ dysfunction. And yeah.
Understood. Wow, sepsis is really something that we need to handle it better. Where can people find more awareness, like more knowledge, or if they want to get aware about sepsis? Is there any kind of publicly available information that they can access?
In as of now in India, now doctors are nowadays the trend has changed.
Okay.
Recently, everybody coming out and talking on social media platform to educate the society. So, as heart attack or brain stroke that has or cancer per se, this has gained knowledge.
Doctor.
This has gained importance in the community, and everybody are making them to aware of those diseases. In such a way, doctors has to come out, infectious disease specialists, general physicians, and critical care specialists like us also has to come out and talk regarding such type of things in the community.
Okay.
As of now, knowledge is everywhere if you want to know about it.
Yeah.
Like now the society has advanced. Like there is a lot of social media platforms like ChatGPT or Google. Some educated people, they can access all these things, but elder people who don't know how to use internet, they need to be educated by the younger persons of the family. Suppose if I suppose for example, if I know a person who is now working and his parents are elderly, I would like to educate the person, like the son of the family, to educate his parents. So the awareness first should come. Means the elderly people cannot understand all this. They cannot use the internet.
Right.
Every information is available in internet, but they cannot access it. But they're not that aware to access all these things. So if you are able to access, that's well and good. That's appreciated. But younger persons of the families or person who is leading the family, they need to educate the elder persons with these basic symptoms and all.
Understood. Now let's move ahead to another important critical care issues, right? Like stroke. So, what is the earliest signs of stroke, and what exactly is stroke, doctor?
So, in simple words, I told like heart attack. No? So that's the lack of blood supply to the heart.
Okay.
Due to some blockage in the blood circulation to the heart. That is, some clot has formed. That clot has blocked the arteries of the heart, the blood circulation to the heart. So that heart muscle is not functioning. That is heart attack. In a similar way, the blood circulation to the brain, there are some 3 to 4 important blood vessels. They can be blocked by some clot, or it can be due to rupture of some few blood vessels also. There are 2 types of stroke, that is ischemic stroke and hemorrhagic stroke.
Okay.
In simple words, there can be blood vessel rupture which is causing damage to the brain cells, or there can be complete blockage of one blood vessel, the artery or something, that can lead to complete stoppage of blood circulation to the blood flow to the brain of particular part.
Oh my God. Okay.
There are 2 types. Okay, in simple words, we need to identify, means we need to be aware of few symptoms, like there will be inability to move one part of the body, like upper limb or lower limb. They are unable to wake up from the bed. They are unable to use the right hand. They are unable to wear the slipper. They are unable to hold the cup.
Okay. There are the earliest signs saying that this person has a
Yeah, there is a code called Be Fast.
Be fast.
So one is balance. Another is like some blurring of vision also is there, and facial deviation, like mouth deviation to one side,
Uh-huh.
and arm drift. That is arm drift, slurred speech, A for arm drift and arm weakness or something, and S for slurred speech, and T for time. So this is a code to identify the this is a code to identify the stroke. That is any weakness in one side of the body, or there is any difference in the speech, or if there is any blurred vision, or is there any difference in the balance of the body. These are few important signs to symptoms to identify the stroke.
Okay.
So if you are identifying these symptoms, immediately call for medical help.
So, like, let's say I identify in by God. I mean, let's say somebody in the where I am standing or wherever I was, I or someone in the group has identified a person is going into stroke because he was slurring or his mouth has,
Traces deviation is
yeah,
there or
yeah, something has happened. What are that? Is there any golden window within which we can act or do
yeah,
something?
this is a very good question.
Uh-huh.
So there is a time period called as window period.
Ah,
So that window period is 3 hours. That is 180 minutes.
okay.
If you identify stroke, like if you think the hand is not moving
Mm.
or leg is not moving,
Okay.
and if you are able to seek the medical help
Mm.
within 3 hours of time, and if the doctor is able to identify that the patient has got stroke, we can treat it with few injections. That is called as thrombolysis.
Okay.
Means the blood clot which has formed in the brain can be immediately dissolved with the help of this injection.
Okay.
That is called as thrombolysis.
Okay.
So it has got benefits, and this is window period, and extended window period is up to 4.5 hours. So
Maximum.
maximum is 4.5 hours.
Yeah.
So the main window period is 180 minutes. So within 180 minutes, that is 3 hours, if you are able to approach the medical help
Okay.
and they are able to identify the patient as stroke, and if they are able to give the injection,
Ah.
there is less damage to the brain cells. Means the clot will be dissolved and circulation will happen, and there will be less damage to the brain cells.
Mm.
So the long term, I mean to say, the long term morbidity of the patient will be less. I mean, long term dependence or the stroke severity will be less.
Doctor, I have a doubt here, right? Earlier on, maybe only the elderly were getting stroke kind of a situation. But in the recent times, we have seen news articles where people even in their 20s have had the experience of a stroke.
So this is called as young stroke. Due to one is due to our poor lifestyle
Okay.
in nowadays community, due to sedentary lifestyle, blood sugar, early diabetes, early hypertension, stressful jobs, and lack of sleep. This is due to bad lifestyle. Means bad lifestyle and also stressful jobs and lack of sleep. The atherosclerosis, that is the stress hormones are increasing, and the fat accumulation, that's cholesterol accumulation in the blood vessels, the clot accumulation, what we are talking as clot in the blood vessels, that's in medical terms is called as atherosclerosis. That atherosclerosis means that the blood vessel is becoming narrower due to the formation of fat deposits in the blood vessels.
Oh my
So,
God.
yeah, that is happening in a rampant, rapid rate even in the young people due to bad lifestyle. Another thing is like due to some genetic disorders also it can happen. I mean the person he himself or herself is prone for clotting tendency.
Okay.
That is another thing. So that is genetic or it cannot be.
Curable.
That's not a modifiable disease.
Okay. Okay.
That's not a modifiable. That's like independent of the risk factors.
Understood.
So what we want to talk about, like what I'm interested to make every people are aware is that modifiable risk factors, modifiable diseases. Okay, which can be modified due to improving our lifestyle.
Mm-hmm.
And the young strokes which are happening nowadays due to atherosclerosis, not due to the genetic conditions, only due to the
Age.
atherosclerosis,
Uh-huh.
either smoking, alcohol, lack of sleep, early diabetes and hypertension.
Food
And
habits.
I have found recently in few of our known people also, their triglycerides are high, their LDL is high, their cholesterol is high. So even for a patient, even for a person who is of like just around 30, now their cholesterol, blood sugar, all the lipids in the lipid profile is abnormal,
Mm.
even in young persons. And there is a lot of belly fat,
Mm.
and many people are having sedentary lifestyles.
Mm.
And also, not only sedentary lifestyle, another important thing is stress. So
Stress.
these are all risk factors, and means inappropriate timing of food also. They will be inadequately fed in the daytime and they overeat in the night time.
Mm. Mm.
Thereby, that blood sugar stays high throughout the night, and the cortisol will be high
Understood.
throughout the night. So the patient is throwing himself into a situation where the blood sugar and the cortisol is high.
Wow.
So it is inviting all the formation of triglycerides,
Mm.
high LDL,
Mm. Mm.
and high total cholesterol also.
Okay.
And due to availability of lot of junk food, easy availability of food
Yeah.
due to like food apps and all.
Mm.
So we can order food in the night at even at 2 o'clock,
Yeah.
even at 2 o'clock also.
Yeah.
Yeah. So, and I will get a biryani at 2 o'clock also. So at that time, if I have a high carbohydrate meal like a biryani at that point of time, definitely the blood sugar will be high, and the hormones will be insulin will be functioning less, so the blood sugar will be definitely high, and the cortisol will be also be high,
Mm.
and the person is awake all through the night. Then how then definitely the later on the triglycerides will be high,
Yeah.
then gradually the LDL will be high, and this all will cause into heart attacks and
Strokes.
stroke, all those things. I
And
think I am too much into medical terminology,
no, no, no.
whether I don't
It's perfectly understandable. No, ma'am. Okay. Like you have treated a stroke patient, like a patient who has had stroke. Now, is it also a multidimensional, or is it like you can alone handle the stroke patient?
No, no, it's definitely multidisciplinary.
Okay.
So first, the patient will be approached by a emergency medicine department, that is called as ER.
Hmm.
Or ED, emergency medicine department. So emergency medicine specialist will see the patient, identify whether he is is a stroke or not. Yeah, they'll identify that. Then they'll be informing the neurologist.
Okay.
So the stroke will be confirmed, and they need to do a CT brain, or whether if it is not a stroke, they need to address accordingly.
Accordingly.
Then after identifying the stroke, then if the patient is not maintaining vitally, that is like he's unresponsive, or his blood pressure is very high,
Hmm.
or his blood pressure is very low,
I'm sorry.
or like his brain is swollen, or depending on the situation I'm telling, then the critical care help will come. If the patient is unresponsive, he
Understood.
has massive brain stroke, then the patient has to be put on ventilator, and the neurologist has to emergency medicine and neurologist, and with the help of interventional radiology also, we can do few blood investigations and through type of CT scan,
Okay.
which can improve the blood circulation to the brain. That is, in simple words, we can. I already told that we can give a medicine called thrombolysis.
Correct.
That is dissolution of the clot by giving an injection. The clot dissoluting injection
Mm.
that can be then, if you are sure of the stroke. Then the second step is if the patient has crossed the 3 or 4 hours time, but then still the clot is there.
Mm.
If you are able to identify the clot through the CT scan, we can take the help of interventional radiology. Uh, Interventional radiologist will be there.
Yeah.
They can go into the blood vessels of the brain and they can retrieve the clot through some instruments like retrievers and all. So that procedure is also possible. That is called as mechanical thrombectomy.
Understood.
So,
Okay.
so such type of extensive procedures are also available to save the brain of the patient. So, it's an interesting stroke is a very interesting, and also the newer advances are available. Community has to know that this kind of treatment is available. That is, thrombectomy is available, thrombolysis is available. So neurologist has to come into play at one particular point. Critical care has to come. Like if the patient requires ventilator, critical care has to come into the play. And interventional neurologist and the interventional radiologist both can resolve the clot with the help of some instruments. That's called as mechanical thrombectomy. All these things are possible. And this has to be known to the common people.
Understood. Doctor, now is 100% recovery of a person who has had stroke possible? Because we are talking about brain damage here, cells damage. Is in the current scenario where the medical field has advanced so much, is it possible for a person who has had stroke come to normalcy, 100% normalcy?
And depending on how much brain damage has already occurred.
Okay. Okay.
So I have seen one patient. He's a young patient, around 40 years. This is like few years back, like some 6 to 7 years back when I was still studying.
Okay.
So that time I have seen one patient. He's a 40 years male patient. He's a gutka chewer.
Gutka chewer. Okay.
Gutka chewer. That was a risk factor for him.
Yeah.
And maybe some genetic predisposition might also be there. We don't know. We cannot blame on just one component. But I'm telling what has happened. He's an young patient, 42 years. He has found himself not able to get up from the bed.
Oh.
So, but the door was locked from inside. So, but somehow he crawled he has fallen out of the bed and he crawled to the door and he opened the door. His voice, he was unable to speak. He somehow was able to call the family members and they have taken him to the hospital. We received this patient into our ICU. Neurologist came immediately and they have done mechanical thrombectomy to the patient. The stroke has happened around like 7 o'clock in the morning. So within 24 hours, we can do thrombectomy. So they have did this mechanical thrombectomy procedure. Initially, there was not adequate voice production was there. But on the next day, he was able to move his upper limb, and also he is able to speak. So it was in my beginning days of my critical care. So I cannot forget it. Like it's a miraculous improvement. So within 24 hours, we have seen this is a positive side.
Okay.
We have also seen the negative side of like the disease. Sometimes even if I do the thrombectomy, it can land up in complication. If the radiologist has done, if the neurologist has done thrombectomy, it has also got side effects like hemorrhage, means bleeding into the brain, or worsening of cerebral edema. There's a brain swelling can happen. The negative side of it is also there. Means it's a very high-end procedure. I mean to say there are complications, or the disease itself is so complex. It can land up in it can land up in complications. Like the brain can get swelling, get cerebral edema. It can go into hemorrhage. The blood vessels can leak into the brain. All these complications are also there.
Okay. So, doctor, I'm asking. Sorry.
This is another side of the story. So I have seen like very good recovery. Within 24 hours, the patient is able to talk, and it's a miraculous recovery, and everybody were happy. This is one side of it. And some patients might develop fewer long-term complications like brain swelling or bleeding into the brain, or sometimes unfortunate situations can also happen. That side of is also there.
True. So, doctor, this one I'm
Situation
asking.
can happen, like anything can happen.
True, true. Anything can happen. We cannot say anything. Doctor, this is out of curiosity I'm asking. In movies, they show that a person is in had a stroke and he has been in comatose for almost 10, 11 years, and then immediately next day he wakes up and immediately he starts walking and running also, talks properly, all that. Is it true?
So immediately it is not. It's a movie. They'll show things in a very faster pace. So cinema is a creation. It's a movie is a creation. So they cannot show how the phases, like how the physiotherapy has happened and how he has improved his muscle power. That cannot be shown in a movie of 3 hours. So they'll put it in a shot that he has recovered. The years of coma means, as you have mentioned, the patient was in years of coma. That is, such type of long-term coma, they will be having long-term muscle rigidity and the bedridden or some infections due to like bed sore, bed ulcers in the body due to continuously lying in the bed. So that can also be there. So, so many complications will be there for a person who is bedridden who is comatose for a long time. That's next part of it. If the patient is getting awake or becoming conscious over a period of time, like not years, like some 6 months or 7 months, if he is becoming normal, it takes a lot of physiotherapy, rehabilitation, and speech therapy, and it is also a multidisciplinary thing.
Yeah.
So physiotherapy, speech therapy, and neuro-rehabilitation, everything has to be done for that particular patient. They are already prone to a lot of infections also, all the infections, and they can be developing the bed sores, that ulcers in the back, thighs and limbs, and all those things. All those can happen, and the attendants has to take care to prevent all those things, and they can develop rigidity of the limbs. So, and muscle wasting. All this has to be taken care, and slowly, gradually,
They
it will come.
Okay.
In a movie, they cannot put all these things in 3 or 4 minutes, so they'll fast track it.
Understood.
And, it's a cinematic experience also. Yeah.
Sure. So, doctor, you have been heading the ICU department, like a busy ICU unit in your.
I was in charge of particular unit.
Okay.
I was taking care of that particular unit and exclusively.
Okay.
My seniors were also there. My senior consultants were also there to guide me if I am wrong, or if I seek any help. My senior consultants were also there, but I was taking care of one particular unit in my hospital.
So that means in your hospital, under critical care, there are multiple units, and each unit is
taken care of by particular person or like that.
So each unit is specific for one particular condition, is it, or how is this divided?
My current working place, they have separate cardiac unit, and one unit is like all medical disorders, like all systems, like kidney, gastrointestines, and lung infections. All this medical ICU it will be called as. So I was taking care of this multidisciplinary unit.
Understood. So, you and your team have to make decisions under extreme pressure, like as you told earlier also, within minutes, within like you have the data. I mean, even that may not help sometimes, but you need to make immediate decisions. How much pressure will be there? I'm sorry, I am getting a lot of burps. Sorry.
I mean to say, pressure in the sense we are practicing critical care since at least 8 years. So I'm into exclusively into critical. Before I was in anesthesia.
Hmm.
So I mean to say, like we are used to that pressure.
Hmm.
That one point I can tell.
True.
Another thing is like sometimes we are trained also
Hmm.
to keep our cool,
Hmm.
keep our cool in that particular situation and to think about the patient
Hmm.
first.
Hmm. Hmm. Hmm.
So regarding decision making, there will be the training includes to take decision according to the like these symptoms, this set of symptoms,
Hmm.
this set of laboratory parameters
Hmm.
will go will direct into particular diagnosis.
Hmm. Hmm.
This
Understood.
and our training includes such type of protocols
Hmm.
that suppose I was telling before, like if the patient has got tachycardia, what kind of tachycardia? Tachycardia means increase in heart rate.
Ha ha.
If the heart rate has increased,
Hmm.
what kind of abnormality it is?
Hmm.
So
Hmm.
what could be the cause of that particular problem?
Hmm.
There will be protocols. We are trained in such a way that we need to identify the
Issues.
cause of a particular problem and to, based on the symptoms, that particular problem is a symptom.
Hmm.
And during clinical examination, seeing the patient, we will be identifying few clinical signs
Okay.
and joining with that few laboratory blood investigations like
Hmm.
or electrolytes or depending on the situation.
Hmm.
We need to correct all those things. We need to join all those things, come to a conclusion, then arrive to a diagnosis.
So it's a
Then
complete teamwork. Complete teamwork.
and complete examination, knowing the problem in depth.
Understood.
It's addressing the problem in depth.
Uh-huh.
So, two steps are there. One is like supportive treatment.
Hmm.
And another thing is definitive treatment. Like supportive treatment is acutely what is the problem, what you have to do, what is the abnormality,
Huh.
and you identify it, you treat it accordingly. Then, what could be the cause of that particular abnormality, and you identify the cause and you give a definitive treatment for the cause.
Understood. So it's a whole teamwork. Like you need to have enough, the right kind of team to support you during any case that is there.
Yeah.
Okay. Okay. Now, end of life care, right? This is something many families are struggling with. Like, what should be their approach? Is there some kind of solution, or during such situations, what is the end of life care, and how do you think that should be provided?
It's a very good question. So, as I told already, some patients can be in the ICU for a long time, like more than a month,
Okay.
or the cause might be not reversible,
Huh.
or the patient may be terminally ill due to cancers, means in stage cancers, or the cause cannot be reversed,
Understood.
or the treatment, the futility of treatment, they call it as futility of treatment. That is, even if I treat the condition,
It's not.
I may not be able to give a quality, able to give the patient a quality of life.
Mm,
I mean to say, even I treat the particular condition, I may not be giving fruitful life to the patient. So
Okay,
that is
I
in
understand.
simpler terms, it is called as futility of treatment. Even I treat it,
It's
there
waste.
not be much use to the person or to the family.
Got it.
And the patient might be suffering a terminal illness, terminal disease. That could be one of the cause can be end stage cancer, or end stage heart disease, end stage lung disease, end stage liver disease,
Okay.
or CKD, which is requiring dialysis for years together and who is not fit for transplantation. In such type of condition, for example, I am telling, or who is a patient where the treatment is not fruitful to the person,
Okay.
the patient.
Hmm.
In such conditions, there is a term called end of life care.
Okay.
I mean to say, instead of prolonging the treatment, and there is no one point to
Yeah. It's
come to that point. There is
it's
no particular end point.
yeah. It's a
There is
trouble
no
even for the
point.
patient. It's a
Yes.
trouble even for the families or the caregivers of that patient.
Yes, absolutely.
Hmm.
So suppose if one person has underwent cardiac arrest,
Hmm.
and he is alive,
Hmm.
but his brain has got damaged due to cardiac arrest.
Hmm.
So he has developed a condition like encephalopathy, hypoxic ischemic encephalopathy.
Hmm. Hmm.
So even though the patient is alive,
Hmm.
his brain is not working appropriately, and the long-term recovery is very very less.
Hmm. Hmm.
In such type of conditions,
Hmm.
or I have already mentioned about cancers and stage cancers. I mean,
Yeah.
stage 4 cancers and all.
Hmm.
Even the treatment is not useful. Then I, as a critical care specialist,
Hmm.
I need to discuss with the family the what are the
Options available.
prognosis. That is, when what could be the outcome of this disease, this particular disease.
Hmm.
So instead of prolonging the treatment, at some point of time, we need to understand there might not be very useful quality of life, a very less quality of life to the patient.
Hmm. 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 Hmm.
So at that point of time, instead of prolonging, we need to come to a situation where we need to not stopping the treatment, but just not aggressively treating. We can put it better words like not doing any new investigations or adding new medicines to cure or something. So I will curtail the treatment to, in better words, it called as comfort care. I will make the patient comfortably alive,
Hmm.
but not. I will not try to prolong the life.
Understood.
I mean to say, I will not put on ventilator, or if the patient is already on ventilator, I will not start the doctors who are treating may not start a newer drug, or may not increase the current drug to higher levels.
Hmm. Hmm.
But I will make sure that patient is given the comfort level of care, that like basic blood sugars, nutrition, hygiene, all those things are maintained in hospital, whichever is basic rights of a human being, and the person is allowed in simple terms, allowed to pass away peacefully
Hmm.
and in the medical guidance.
Got it. Under medical guidance, the person is allowed to leave the body easily.
I mean to say, we are just making the person comfortable,
Hmm.
and we are not escalating the treatment to higher levels. That is also called as do not escalate.
Okay.
And if the patient heart stops suddenly, there is a term called do not resuscitate.
Okay.
So we are not unnecessarily prolonging the suffering of the patient.
Doctor, how do you handle the caregivers or the families of patients who are under such a grave situation?
So definitely, I need to be empathetic to the family. That's a must quality of a doctor.
Hmm.
So, an empathetic human being is a correct doctor. So I need to understand the feelings of the family members. I need to identify the human being as a not just
Yeah.
like appropriate along with the appropriate treatment. I need to address the emotional component of of the family of the human being who is suffering.
Correct.
So there is something called as dignity of death.
Dignity.
So
Uh-huh.
dignity of death. So I mean to say, even in the patient is allowed to die,
Mhm.
but in a dignified way. I mean to say, I need to give respect to their religious practices.
Okay.
I need to respect their emotional component.
Hmm.
I need to give space for the family to allow, or I will be allowing the family members to stay or pray for the patient, or practice their religious customs. All those will come into the taking care of the family in the that particular point of time where they are facing grief. Uh, in that griefful moment, the doctors and the hospital staff, nursing staff, and also the all junior doctors, the consultants, everybody has to support the family in both emotional and empathetic way.
Understood. Understood. So you have seen so many critical care situations, right? You said you have been practicing for more than 9 years now. So, what has this field taught you, doctor, about life, about people in general?
Definitely, I have to say this. So I have understood Gita better after coming into critical. So I mean to say, we will understand the life. There is quotation called saying that we hear a lot of prayers in the hospital than in a temple. All the family members will be praying for the soul,
Yeah.
praying for the patient. All his dear ones are praying for the patient. All the like one more quotation is also I heard, like there is no other person who is more secular than a doctor. Like I don't see the patient as a other religion person or the caste person. The patient is a patient to me. I don't see him or her as a gender or based on the all discrimination what we see in the society.
Correct.
A doctor cannot see the patient in such a good doctor. Obviously, everybody are a good doctor. So a doctor cannot see a patient in a discriminative way. I've recently seen a reel in Instagram, I think. One neurosurgeon has given his own blood to a child, and then he operated on the same child.
Okay, that's
So there is no other person who is less discriminative based on the less discriminative.
true. True.
And also, I feel studying medicine will teach you a lot of philosophy. We gain maturity while dealing the patients, and also I learned a lot of things even regarding finances. Also, how to plan insurance, how to how to plan my retirement, how to plan my medical bills, everything, and also how when to plan my checkups, everything after I come into medical field per se.
Understood. Doctor, in this critical care unit that you are handling, or per se any critical care, right? The instruments that you use, what kind of instruments or will be in place for the emergency units?
What I mean to say, what kind of instruments there are will be
Yeah,
available
yeah,
in
yeah.
ICU.
Correct.
So importantly, there are we need to put him on ventilator, such kind of like laryngoscope, endotracheal tubes, and emergency drugs to pick up the heart rate or pick up the blood pressure. Like they are called as adrenergic drugs, inodrops, vasoconstrictors, a few drugs and instruments which can help the patient to get onto the ventilator. And there are instruments like we need to give medicines into the blood vessels directly. So there are central line, and there will be in simple terms, head to toe, all organs has to be supported in critical care. The main purpose of critical care is to support the failing organ.
Okay. Okay.
Failing organ. That failing organ can be anything like heart, lungs, kidney, liver, or brain. So, brain we cannot per se. We need to give medicines only, or few procedures also are there to improve the circulation and all. Like I already mentioned, thrombectomy and all.
Yeah.
Per se, we have if I have to support the heart, I have medicines. And also, I have if the patient is undergoing like circulation, low circulation, then I need to put on IABP, or in very higher setups, they may be put on ECMO and all. Or else the patient's lungs are failing, then I have to put him on ventilator. If the kidneys are failing, they have to be put on like dialysis, and the catheters will be there to they insert into the blood vessels.
Understood.
Those all supportive instruments will be there.
Okay.
And like dialysis, plasmapheresis,
Yeah.
all those things. In some higher institutes, like we can monitor the intracranial blood pressure. All those things are also in the intracranial pressure. I mean to say, intracranial pressure we can also monitor. Such type of things are also there.
Understood. So let's say, like, what in your opinion is that one thing that every family should understand about emergencies and critical care units?
Basic life support and calling emergency help immediately.
Okay.
That those two things I will advise everyone in the community. Basic life support, we were already discussing that cardiac CPR and all.
Yeah.
And emergency help, we need that medical emergency team. You have to immediately contact without any delay.
Any delay.
Something. And we already discussed like stroke, be fast, like balance, facial deviation, all those things.
Anything they see abnormal, they need to immediately approach the emergency. Yeah.
Medical emergency team.
Got it. Got it. Okay, amazing, doctor. Thanks so much. This conversation has been so insightful, right from what needs to be done to what the golden hour is, what Be Fast is. You give so much of information, doctor. This is really amazing. We at Blumberr, we really value this, and we definitely think that our audience will be benefited from this podcast, right? So it is so important to understand the life care that we can take about ourselves and when it is critical to approach the emergency services. And the difference between panic and response can often be the difference between life and loss, right? So thank you, doctor, so much for all your insights and all the information that you shared with us. I really appreciate your guidance here. Thank you so much, doctor.
I'm very thankful to Blumberr for giving me this opportunity to create awareness in the community. And as you rightly said, panic and response are the two important things. We need not panic. We should not panic and do the rightful thing. We should give the rightful response at the particular rightful time.
True.
So you have correctly put in right words. I'm very, very thankful, and also I'm very happy that your way of interviewing and also the questions you have asked. It made me talk elaboratively. I'm very grateful for the opportunity.
We are also grateful for having you here, doctor. It was a pleasure, and I definitely want to have one more session with you, a little more elaborate about particular situations possibly, and maybe listen to more of your experiences also. Yeah. Thank you so much, doctor.
Thanks.
And
Thanks.